Hi, I'm here at the ASH in San Diego in 2018, and I've presented an oral communication on CAR T cells specific for this antigen called CD30, which is one of the markers of Hodgkin lymphoma. And this is a second trial that we've conducted in our center. A few years ago, we did a clinical trial in which we used the same CAR T cells, but we gave these CAR T cells to patients that had malignancies that were positive for CD30, but we did not treat these patients with any drugs before giving the cells. In that context, we see no toxicity. We were able to show that actually these CAR T cells were able to expand in the body of those patients. And we saw a couple of good responses, but less than what people became accustomed to seeing in trials involving CAR T cells. And so after analyzing our methods and the way we had developed our protocol, one thing that was clear from other studies, even what we've done in our laboratories in our center, was that adding some chemotherapy before giving those cells is important. It's possible that actually specific types of chemotherapy may be important. Usually the chemotherapy that people have been using, cyclophosphamide and fludarabine. And so we created a new version of the trial, now incorporating chemotherapy. And in terms of what we see, definitely the cells expand much better in the body, and so we get 2 to 3 log increase expansion in the cells. And so we think that expansion is associated with response. We do see a little bit more toxicity with this expansion, but all the toxicities have been grade 1 at most. So cytokine release syndrome is a problem that you see frequently with CAR T cells, but what we've seen has been very mild, and we've actually not treated any patients with tocilizumab, which is a drug that usually is used in that particular setting. And we also see these frequent toxicity, which is a skin rash that can be quite dramatic, but it's really, from the patient standpoint, has been asymptomatic and resolved spontaneously. And in the setting of these better expansion of cells, we've actually seen better responses. So right now we've treated 11 patients, but we only have 9 of them are evaluable in terms of response, but 6 of those patients had a complete response. Some of them have been durable, some patients have progressed, but we're quite enthusiastic about all these results so far.